All right. Good evening. Good evening, everyone, and welcome to Atp Live Monday. I hope we've all had a beautiful, beautiful day. Thank you so much for joining me, whichever platform you're watching on. Welcome to ATP Live Monday. For those joining on Instagram, you're welcome. Thank you so much. I am Gbemisola Boyede, and I'm your pediatrician for today, and I will be answering any questions that you may have about the health of your children. However, before we start, I think we should just try and share the videos so that everybody we see and they can join us as well. So give me a couple of minutes so that I can just share the video and then we can start. ATP Live Monday is a program where you get to ask any questions you may have about the health of your children, and we try and answer them in an hour that we have. So thank you so much for joining. Feel free to invite your friends, invite family, invite everybody. Let them join us now so that we can answer the question. We can do this program. I hope you've had a lovely, lovely day. I mean, I can't believe we're in February already. The year is just running so fast. And I hope you've been learning a lot on our platforms. So this program brought to you by Ask the Pediatricians Foundation, and Ask the Pediatricians Foundation is committed to the health and welfare of all children globally, but especially in sub-Saharan Africa, where a lot of our children still die from preventable and treatable conditions. So we empower parents through all our online platform, and we also do community medical outreaches in hard to reach places to make sure we help parents understand what they need to do to help their children to survive and not die. So that is what we do. Complete bridal touch and events. Thank you so much for joining me. You're welcome. Thank you so much. So whichever platform you're watching on Facebook, on YouTube, on Instagram, you're welcome. And for those who are watching the repeat episodes, maybe on our podcast or any other platform, I want to welcome you in advance as well. So thank you so much for joining. Please share the video to wherever you can share it to, so that people can join us and they can ask the questions. So we just have a couple 1 hour today to answer questions, but just to let you know that even after the live session, we have our Facebook groups where you can ask your questions from Mondays to Saturdays, 24 hours every day. We're always there to answer your questions. So it's not just once a week or 1 hour event. You can always ask your questions at other days. Just go to our Facebook groups and then you can ask your questions there. We also have ATP Family for the adults related kind of questions. We have ATP Still a Mom. We also have a First Time Moms group. So all these groups, we have created them to support parents in understanding what they need to do to promote good health of their children and what they need to do when they notice anything unusual in their children. And then also on Thursday, we do teachings on specific topics. Last week, I talked about antibiotics misuse and overuse, and I hope you've all listened to that. If you have not, please go and listen to it, and please share that message. It's something that we really need to address, because one of the main challenges we're dealing with right now is the issue of antimicrobial resistance. So it's important that we all contribute and do our part in ensuring that our children are not dying from these resistant organisms that we cannot trace. So it's so important for us to do that. So welcome. Now I think I've done all the sharing, all the pinning. Thank you so much once again for joining me today. For those who are just joining, I'm Gbemisola Boyede. I'm a pediatrician, and I'm here on behalf of Ask the Pediatricians Foundation, non-profit charity committed to the health and welfare of our children, to answer any questions that you may have about the health of your children. Just a few housekeeping announcements. Please start every question with the age of the child. Don't just tell me my baby, my baby. We need to know the age, because when we are answering questions for pediatricians, we need to know the age, because we deal with children from 0 to 18 years. So it's very important for us. And try and go straight to the point and try and ask questions. People sometimes just drop information and no questions, and I'm wondering, what do you want me to do with that information? So try and ask very specific questions, and keep it to short and simple, and then when it comes to rashes and things like that, we need pictures, and unfortunately you cannot post picture in comments. So for those kind of questions, you have to go to our Facebook group and post your pictures there, and we'll answer them. But please don't post pictures of genitals, private parts of children, offensive pictures like stool picture, vomiters, all those kind of pictures. Don't post in our group, but we're not going to approve them. All right. So I think those are just a few housekeeping announcements. And if you are watching a rebroadcast, like you're watching outside the live session, you cannot get your questions answered for obvious reasons. So for such people, please just go to our Facebook. So if you are not watching on a Monday and you're not watching between 6 p.m. Nigerian time to 7 p.m. Nigerian time on a Monday, you are watching a recording. In that case, please go to our Ask the Pediatrician Facebook group and post your questions there if we have not yet addressed your questions. All right, I think I'm ready to start now. I can't see any question on Instagram, but there's one already on Facebook. So I will start with Facebook. So, but feel free to post your questions as I'm talking. Sonia Omote, thank you. Okay, just a greeting. Thank you, Sonia. Say hello, ma. Thank you for all you do to make sure that our children are in good health. Thank you so much for joining me, Sonia. I appreciate that. Okay, Loretta Mo, say you look so gorgeous. Oh, thank you. That's very kind of you. Thank you, everyone. So please, I'm here now to answer your questions. Feel free to ask, and we'll try and answer in the short time that we have. Okay, I don't have any question now, so let me just be waiting for the questions. And while waiting, okay, Sonia has asked a question, so let me go straight to the question. All right. You said you complained sometimes ago. You complained about my son. I complained about my son was 2 years old, but talks off and on. I think he suspected autism. Okay, it was confirmed at the teaching hospital that it was some spectrum, but I'm not sure if it's mild or moderate. Okay, I'll come back to that. They also said they don't have speech therapists. I know. Yeah. Okay. Okay. All right. Okay, sorry for those who are not watching. Maybe I should read the whole question, because some people are not reading, and so they need to hear all my. Okay. So basically, Sonia is asking about the support available for our child who is on the spectrum. Can you remind me your location? If you can tell me, not your address, just the states. That's all I need, and I can give you an idea where you can get support. Okay, number one, there's nothing like we don't tend to use the word mild, moderate, severe anymore when we talk about autism. We tend to say that everybody is on the spectrum. Okay, so autism spectrum is a neurodevelopmental disorder where children have difficulties with social communication, social interaction, reciprocity, and then they tend to have what we call repetitive and restricted behavior. So there are certain things, so there are criteria for us to make a diagnosis of autism. That is the first thing. So if your child ticks the boxes, there are 3 boxes under A and there are 4 boxes under B, but your child needs to tick all the 3 on the A and then tick 2 on the B. And once the child does that, we make a diagnosis of autism. Now, in terms of, we don't classify mild, moderate, severe. What we try to do is to say what level of support. So there are people that tends to confuse some people, because there are people who have autism and they go to mainstream school. We have doctors who are on autism spectrum. We have professors who have autism. They do everything else, so but they have autism. Again, you also have somebody else on the autism spectrum who does not talk at all, no language, they are constantly rocking, head banging. So that's another end of the spectrum. So it's a huge spectrum from one hand, from somebody else that everybody will suspect that this person is just different, but you don't really know whether they have a diagnosis or not. So somebody who really, even an average mother on the streets can say, yes, this person has autism. So there are two extremes. So what we normally classify is what is the level of support that child needs. So we have what we call level 1, level 2, and level 3. So level 1, level 2. So if a child needs some support, everybody needs support, I guess, but not much. The child can cope with mainstream, the child is talking, the child is, so we say those are level 1 children. Then we have level 2. Level 2 is where majority of children, for those children, we definitely need some support in speech therapy, behavior therapy, and all that. And they can cope in mainstream school, but they will need somebody providing support for them. Whereas level 3 are the severely autistic children. Some of them cannot even cope in a regular school. They have to go to a special needs school and all that. And so it is the job of the pediatrician doing the assessment to decide like what level the child is. And most of the time the diagnosis is for life, but the level of support may change. So you've given me information now that you are in Kano. So I guess you went to Aminu Kano University Teaching Hospital. Unfortunately, Kano, I don't think we have so much of services in Kano. I don't know whether you're somebody who is flexible to moving. If yes, then you may want to think about Abuja. Abuja then tends to have a lot of people that can support your child. Another option now, thank God for technology, is that of virtual support. So there are a lot of speech therapists that can do speech therapy online. There are a lot of behavior therapists that do online support. So but of course, they can be a bit expensive. But if you are open to those kind of support, just send us an email, or just send an email to askthepediatricians@gmail.com, or just send us or ask on our group. Then somebody will send you our WhatsApp number, or send me a message on our WhatsApp, ATP WhatsApp number, and I will give you the link to those who provide virtual therapist support. Even if you also go on YouTube alone, sometimes I always tell some of my parents that live in those areas where we don't have as much service, that you are your child number one therapist, and that means that you may have to learn. And this is not even an exaggeration. We've had instances where parents actually went to train themselves so that they can provide support for their children. I know services in Lagos now that started because when their child was diagnosed, they didn't have any support. So the parents themselves went to train, and now they run the business, and they are actually supporting other children as well. So you may also think along that line. But if you're also open to private therapies, online therapies, we can signpost you. But when it comes to North, I think Abuja is where you get most of those support. You can Google online and see. You can also go to YouTube. There are a lot of speech therapists that have put in a lot of resources online, and that you can be watching, and you can be practicing with your child, and that will also help the child. Unfortunately, in Nigeria, we're a little bit limited in terms of the support that we have for our children, but there are ways around it. You can relocate, you can go for online support, or you can train yourself to actually be your child's therapist. Therapy is not rocket science. It's just understanding the principles and beginning to apply it yourself, and your child will be fine. All right, I hope that's helpful, Sonia. All right, Instagram, please ask questions. I still don't see any question on Instagram, but I'll continue with Facebook. Chinna, yes, say my son completed 4 years August in 2023. I noticed he wanted to develop the stammering. Okay, I tried beating him. Please don't. I really felt so upset. Obviously, as a pediatrician and as a child advocate, I don't like it when parents will beat our children for things that they have no control over. A child stammering is not the child trying to be naughty or the child trying to be um I mean, so what are you beating the child for? Honestly, why? So please, let's stop all these. I know it's the way we grew up. Any little thing, we just start beating children. Please don't beat children for everything. Try and understand first what is going on. Why is the child doing this? Everything is not beating, and sometimes beating is not even the solution to most of our children's issues. So please, let's stop beating our children for everything. If possible, let's just stop the beating. So a child who is stammering may have some reasons, for the stammering, and what you need to do is to show support and understanding and not to beat the child. Everything, no, everything is not beating. All right, so please stop it. So, it's not so severe, but I'm concerned because there's no history of stammering. There are many reasons why children can stammer. Sometimes children actually stammer because maybe they are rushing to speak and they just want to quickly get the words out. So sometimes just being patient with them and allowing them to get their words out, then they know that okay, they can get their words out and there's no pressure. That is all they need, that understanding environment. And if they are so scared of you, for example, you that your child, any little bit, you start beating the child, then your child will stammer because they have anxiety around you. They are so scared, so they can't even get their words out. Sometimes it's just a passing phase. Children just went through a phase where they stammer and it just stopped on its own. So there are many different reasons why that can happen. The most important thing for us to understand what is going on. But the most important thing, even if you don't know why your child is stammering, the first thing you don't want to do is to beat the child, and then you don't want to rush that child. I know most of us are always impatient, but the thing that a child who is stammering or anybody who stammers, what they need from you is that patience. Just be patient with them and allow them to get their words out. Because when they realize that they are not you are not putting them under pressure and all that, then they actually can calm down and they can actually get their words out better. So, of course, that's another thing. Then, two, you can see a speech therapist if you think there's more. The speech therapist can do their own assessment, but most of the time it's just about patients in this age group. Most of the time it's a passing phase. Sometimes you also make sure there's nothing that is making a child anxious in school and nobody is uh, bullying the child. There's no other issues. It's not everything is genetic. It's not, so every stammering is not genetic because you're saying there's nobody stammering in your family. You don't have to have a stammerer in your family for somebody to stammer. So it's not always genetic. So sometimes it's just a passing phase. Sometimes the child is anxious. Sometimes the child has been bullied. Sometimes the child is just also rushing and they just need to slow down, and then we just need to be patient with them, and sometimes they'll get it out. And if you think it's really bad and it's persistent, you are doing all the right things and there's still no solution, then please see our speech therapist and then they will take it up from there. All right, so I hope that's helpful. But just relax. I think you also need to relax yourself because children pick up on your own anxiety. And when they pick it up, it's actually worsen their stammering. So, but if you relax, then things get better. All right, sorry. I hope I wasn't too hard on you or harsh, but I don't like it when you beat children for things that they have no control. It is really not good. Yeah. How would I put it? It's just like you just think of yourself as an adult. You make a mistake and people start beating you. How will you feel? And the children also have their own emotion and feelings as well. The fact that they are weak and small does not mean we should do that to them. We all make mistakes as adults and nobody's carrying cane on us. So please let's be gentle and patient with our consistency. All right. So as I've spoken to you as a child advocate, so we are the ones that speak for our children. All right. I have a question on Instagram by Complete Bride. Such an event when a child under 4 years of age coughs so hard to the point of vomiting of food I realized this when she was a baby, and when she was 3 years old, she's 4 years old, she was sick of malaria last week. During that time, she had that catarrh and began to cough. Well, anyway, if a child is coughing and coughing to the point of vomiting, we classify that as a very severe cough, and you need to take the child to the hospital to know why the child is coughing, because obviously this is like, it's not like something that is happening all the time for your child, because say it happened when it was 3 years old, now it was up when she was a baby, and when she was 3 years old, yes, and now she's 4 years old. So it may just be your child's own habits, like when the child has cough, because the child is trying to clear the airway, they're trying to clear out whatever is irritating their throat, so they cough so much and it can lead to them vomiting. So the most important thing is to deal with what is the underlying cause. But the reason, actually, what I was initially thinking you are going to talk about is there's a type of cough that we call whooping cough. So children who have whooping cough will cough and cough and cough and cough and then vomit, but it is not recurrent. So if you have whooping cough, you have it and that is it. You're not going to have it again another year or again another year. So if this is happening again and again, that sounds like that is that child's habit of dealing with cough. And so you can just go see the doctors and let them evaluate the child. So the child has fever, the child breathing fast. If yes, you may need to see them fast. But otherwise, if a child is coughing and vomiting, we will worry about it, because we tend to get that in whooping cough a lot, and not but from the way you describe it, I'm not sure that is it, because that one is not just the child cough and then vomit. The child will cough and then they will vomit at the end. It will end with what we call a whoop, and then they vomit. So that's the one that was describing, but it doesn't sound like the typical. And then it doesn't tend to be so recurrent. And also, you expect that if your child has been immunized, your child will be protected against that kind of cough. All right, but whatever case, I'll recommend still seeing a doctor. Let them examine the child, and then they can take it up from there. All right, Tara Caroline. Sorry, my son, 4 year old, starts sucking his thumb. Just started sucking his thumb. Okay, that's very unusual. Usually, most children that suck their thumb have been doing it all along, and then usually by the time they're about 4 years old, that's when we expect it to stop. So if your child is just starting at 4 years old, that is a very unusual thing. And then the question is why. So most every time a child picks up a behavior, they are communicating something to us, they are telling us something is going on. So it's either they are copying somebody and they think other people are doing it, maybe I should copy them, or they are stressed about something, or they are being bullied about something, or something is going on. So you need to, a 4 year old is old enough for you to have a conversation with them, to talk to them, and try and figure out what is it an habit, is his child copying somebody. You may want to speak to the teachers as well, understand what is going on in the school. But in the interim, what you can do for children that suck their fingers is give them something to do with their hands. Give them something. When the child has something to do with their hands, they will unlikely be sucking it. So give them something to write, something to paint, something to do with the hand. Let that hand not be free for sucking. And sometimes some children do it as a self-comforting behavior. So the question is, why is the child needing to comfort himself, sucking their finger? So you need to work out what is going on, especially in a child who wasn't doing it before. I will worry much about it. If it's a child that's been doing it as a baby and they are now just, because we expect them to actually outgrow it by the time they're about 4. So if the child is now picking it up at 4, then I would definitely worry about it. So look at the scenario, talk to the teachers in school, just figure out what is going on, because that will also help you in how you help the child, because sometimes you just need to address the issue that is making the child to resort to sucking and all that. It's just like when children start to bedwet who are not bedwetting before, there's always something that is happening, and it's your responsibility as a parent to work out that there's nothing emotionally disturbing that child, and nobody's threatening the child or bullying the child, and a lot of things go on that we as parents we may not be privy to, but if we put down our eyes and talk to people that are around, you may be able to figure it out. So I hope that's helpful. Major Evans, good evening or welcome. Thank you for joining us today. All right, let me go back to Facebook. Okay, blessing Eleocho. I'm sorry I didn't pronounce the surname well. Good evening, ma. Thank all you do. I have a baby of 9 and 2 weeks. When you say 9 and 2 weeks, it's in 9 months and 2 weeks or 9 years old and 2 weeks. So whenever you're saying the age, please always write it in full. Right? Whether it's 9 years, 9 months, 9 days, always write it in full. That way it makes sense. Otherwise, we can make assumptions that will be wrong. So I want to assume it's 9 months because you said because you are putting 2 weeks after. So I hope so. Okay, so you took your baby to the hospital. They discovered the red blood cell is low, which led to blood transfusion. Wow, that's serious. And the blood transfusion is now the white blood cell is high, 10 to 14. Okay, how can the white blood cell be reduced to normal? If your baby is 10. So why did you go to the hospital in the first place? You didn't tell us that. So always give background. So you must have gone to hospital. You don't just go to hospital for no reason. So there must be a reason you went to the hospital, but you didn't tell me that. You only jumped to the fact that the full blood count should low red blood cells and they have to transfuse your baby. The reason why I'm asking is because the reason why you went to the hospital may be the reason why the white blood cells are high. Because high white blood cells tells us that maybe there's an ongoing infection. Um, and you didn't even tell us exactly what it is. You said 10 to 14. I hope you are not reading the wrong place because it depends on where you are reading. Because usually we don't say white blood cell is 10 to 14. We give it a figure. It's either 14,000 or 10,000, or unless you are saying they've done it twice. And usually if they just transfuse a child, it doesn't make sense to do a blood test after you just transfused. Because what you are checking is a blood you just transfused, not the child's own. But if it's a level before the transfusion, then it makes sense. Anyway, don't worry yourself. You are in the house. I hope you are still in the hospital. If you are still in the hospital, that is the headache of the doctor who is treating a child. So they know what to do with the full blood count. They know what to do. So they transfuse the child, but they need to know what to do with the white blood cell that is also whether high. For example, 10,000 is not high. That's why I'm actually trying to figure out where you are looking. 10,000 is not high, but 14,000 may be on the high side. So I don't know which one it is. You see that they did it twice, because usually we don't write it as a range. We usually write it as one figure. And anyway, but just speak to the doctors who are in charge of that child. And I hope they took a blood sample for the child's genotype and all that before they transfused. Because if they've transfused, we can't do that blood test again until another maybe 3 to 6 months. So because it's very unusual for a baby to be for the blood to be so low that they have to transfuse. That's a major issue. Transfusion is major. So it's very important, number one, to know why your baby's blood became so low to the point of transfusion, and why is actually the more important information that I have not figured out, because you didn't tell me what was wrong with the baby before. You didn't tell me all that information. So it's very important to know the why. The why is the most important thing, because even after the transfusion, which is just like a stopgap measure, we need to know how to prevent future events and stuff. So you need to have this conversation with the doctors. There are a lot of things, and I think I'm actually going to do a topic on that, do a teaching on that separately, because I notice a lot of parents, we don't talk to our doctors. I think it's our doctors first, really, because and I think you guys are being nice to us and feel like, oh, the doctor is too busy, there are so many children to see, so let me not ask my question, let me not waste their time. No, please, you are not wasting anybody's time. It's your right to know everything. You have a right to ask question. Why was my baby's blood low? Okay, why? You must always ask the why. Feel free to ask why. And it is our responsibility as a doctor to tell you all those things. So for me, you really need to know all the why of all this. Why is the red blood cell low? Why is the white blood cell high? Why are they giving child blood? What can we do to avoid it? So you must ask them, and they have to tell you why. It's their responsibility to tell you. It is your right to know. So let's not be scared, or let's not be thinking, oh, I don't want to waste doctor's time. Please waste our time. Ask your questions, because it's your responsibility. It is your rights. It's our responsibility. We should be telling you anyway, but I know some of my colleagues sometimes, maybe because I know we are all overwhelmed, but please ask us, and then we should be telling you all this information. You don't need to come online to ask. You need to really know. The doctors need to tell you why. I also want to know why, because transfusion is a big deal. So it's very important that we know why. All right. So, Sonia is saying one more thing. Doctor that attended to us last time prescribed risperidone. Please don't give that child risperidone. I really, we want to move away with giving children medication for behavior issue. And your child is it 2 years old? How old is this baby again? Yeah, who was 2 years? Yes, please. No, it's too young to be given risperidone, please. Um, mm, 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 mm. No, no, I don't agree with that. Please, let's stop the risperidone. Um, no, 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 no. Just stop it. And your child doesn't have ADHD. We don't also diagnose ADHD before two. So, I mean, before 5 years old. Okay. How do I support you now? Okay. Unfortunately, in Nigeria, we don't have enough professionals who are skilled in developmental pediatrics. That's my area, so I definitely know what is going on. It's a relatively young specialty, and it is not every pediatrician that knows how to make those diagnoses or assess the children or even manage them properly. So, for example, all these things you have said now is really wrong. Number one, your child should not have been given risperidone just because the child was throwing tantrum and all that. That's not enough reason for the child to be given risperidone. Two, we don't diagnose ADHD in a child who is less than 5. In fact, some of us won't do it until the child is 6 years old. Okay, that's number two. Then, from what you've told me so far, your child look like the child who is not talking, blabbing. That is more of autism than ADHD. They are two different things, but some people kind of get it up. Again, lack of knowledge and understanding of those kind of scenario. Um, uh, because I'm not sure who is the pediatric neurologist or do you know what? Send me a WhatsApp message on our WhatsApp number. I'll try and see how we can sort out all these issues for you. I don't. I'll try and figure out who is in Kano and who can support you, but I don't want them to mess up this child's. Anyway, let's leave it at that. So, but send me a WhatsApp message. We'll take it up from there. Sorry about that. But please don't. I hope you have not started risperidone. If you started, please stop it. Just stop. Just stop. Don't even give it to the child. It's really a very bad drug, and we don't want to give it to very young children, and it's really not appropriate. So when children have issues, behavior issues, we don't medicate everything. Everything is not medication. And autism, yeah, risperidone can be licensed in people with autism, but there are criteria for doing that. And those medications have very terrible side effects. They need to be monitored and all that. So it's not something I'm going to give to a 2-year-old. Never, never, not to a 2-year-old. So please, you should stop it. And then we can talk. I'm worried about where you are. I hope you won't have to move so that you can get your child. Sometimes I've seen parents do that. I know it's hard, but I've seen parents move just because they want their children to get the right support. So you may want to consider it. All right. All right. Deadline. Okay. My son of 3 years. Okay, so today seems to be like Spectrum Day. Okay, but it's actually April that we celebrate Autism Spectrum. That's when I tend to answer a lot of questions on autism. But it seems like we have a lot of children on the spectrum, and I'm really pained that we don't have a lot of professionals who can do those assessment and all that in Nigeria. It's really a shame, but we'll get there. Okay, so your son goes to a mainstream school. He can talk, but not fluently. He can identify, right? Okay. My challenge is that he cries a lot, especially when he wants something. He'll be crying and throwing himself down. Okay, that's like a tantrum. How can I go about such situations? So yeah, so children on the spectrum can have tantrums. What we normally do for behavior is to understand the why of the behavior. So I will try to do what we can do to avoid it in a way or to distract from it in a way. So we have lots of resources on behavior management. So I would recommend, because answering that your question is not a quick kind of answer like that. So I can spend a whole day teaching you how to manage behavior. But bottom line, in if I want to keep it very short, is that what normally triggers the behavior? Is there something we can do about those triggers and avoid it? And I know sometimes parents we don't want to appear like we are too lenient, or we are too we are too indulgent with our children. But you see, a child on the spectrum is a different child. It's different from your other children. So some of the things that the way you will train, or the way you will raise your children who are not on the spectrum, is not going to work for children on the spectrum, because they don't understand and they can't reason the way you want them to reason. So they don't understand. Some of them don't understand waiting. They don't understand taking turns. They don't understand why they can't have what they need to have at that time and all that. So sometimes at the beginning is a bit of trying to understand the why of the behavior, and not see it as oh, I shouldn't do that, and I'm not going to do it, and you're going to end up with a tantrum. And it's difficult to console the child, and it's difficult to get them to understand why you're doing that. So it's about understanding the why of the behavior. So if I look at this now, if you want something, when he wants something, what does he want? Is this something that he really needs? For example, a child needs food, a child needs a drink. There's nothing wrong with that. You should give it to the child. So, but if it's something like dangerous and you don't want the child to have something dangerous, so what we normally do in that situation sometimes is to give them an alternative that is also good, but that they can have instead of the one that they are asking for. So in other words, you kind of make a trade and better. So you're like, okay, you can't have, let's say you don't want to give the child a tablet, but you can give them another toy that they also like to play with, and that one is better. So you sometimes you have to find a different solution. Sometimes it's about anticipating and avoiding that scenario in the first instance. So there are many ways that we deal with those behavior, and it's about trying to either avoid the scenarios, give an alternative, or distract them. So once you know that the child is going to do this, you distract them from that. Some children, sometimes they just need to burn out some energy. You let them go jump on the trampoline or something, and they are trying to regulate themselves. So there are many different. So we actually have what we call behavior analysts, applied behavior analysts, behavior therapists. That's how they do, supporting children on the spectrum. But you as parents, so you can learn how to, manage some of this. Of course, there are still some children that no matter what you do, they're going to have their tantrum. So what you need to do in scenario like that is to try and keep it as short as possible and just let them be. And sometimes just let them run out of the thing and don't feel, because sometimes parents feel self-conspicuous and they feel like everybody is looking at me. Everybody feel like I'm a bad parent. I'm not training my child well. And because of that, parents start to try to shorten the duration and trying to stop the child. And sometimes you just have to accept that my child is on the spectrum. They are going to have these tantrums, and it's okay, and let them do it. So, but look, if you begin to understand your child more, you begin to anticipate, you begin to avoid, you begin to give distraction, then you may actually get less and less spectrum. Some things are even related to sensory issues. Some children need something to bite on. You give them chewable toys different from the wrong things that they want to buy on. So it's all about so I recommend first, if you're a parent, for go and read around autism. There are lots of lovely websites. If you I don't maybe if you just go online, but I always recommend go to places like Autism Speaks, National Autism Society UK, Autism Wales. Some of the almost every country has their autism association kind of, and all of them have all these. Don't just read around private individuals websites. Reason why I said that, there are a lot of private individuals that put a lot of, they want to sell drugs to you, they want to sell you supplements, and they will swear by heaven and earth that once you give that supplement, everything is going to disappear. It's a lie. Just take it from me, it's a lie. So there's no supplement, there's no food, there's nothing that once you give to the child, everything will disappear. There's something like that. So, but if you read on websites from organizations or country website and all that, they tend to have more balanced kind of information. There are also a lot of parent support groups on Facebook as well, all over the place that you can join, and you can ask questions, and parents will tell you. Parents will also have other children who have gone through this journey. They will tell you, this is what works for me. Of course, what works for one child may not work for another child, but with, you begin to get more information, you begin to understand your own child, and you begin to try different strategies until you get what works for your child. And also, if you can get all the behavior therapists, they also work for that. Sometimes children are having tantrum from frustration. They are trying to tell you something and you simply don't understand what they are trying to tell you. And so they communicate by, having tantrum. So just reading around it, understanding what is going on, and trying to apply different strategies, that will be helpful. Like I said, if I start talking about that topic, we can spend the whole day on it. So I will pause at this juncture. I hope I've not missed any question on Instagram. If I missed a question on Instagram, feel free to repost it, because Instagram question kind of stroll away. So if I missed it, I've missed it. Okay. All right. So when you say your child was not feeling fine, blessing, that is not an answer to a pediatrician. So I can't make any meaning out of my child is not feeling fine. You need to tell me what is exactly wrong with the child. My child's body was hot. My child was vomiting. My child was passing water to. My child is coughing. My child is having running nose. That is more relevant. But saying my child is not feeling fine doesn't really I can't make any meaning out of it, because there are many reasons why a child who is not feeling fine. In fact, any child who went to hospital is not feeling fine. So, but how do I know which one is which? So you've not really answered my question. So you need to be very specific. What exactly is the child not feeling? Abi, how do I say it? What exactly is the child feeling? So that I can give you some inputs. So if your child, so when was the first blood sample taken? When was the second blood sample taken? So important. So for example, if your first blood sample of your child was 10,000, that is normal. That is not high WBC. So if they now took a sample after transfusion, then it's difficult to say whether the new sample is the blood that they just given to the child. So it doesn't really make any meaning. So unless they've taken that sample like 40 to 72 hours after that transfusion, that's when it will make sense. So normally they should not repeat the full blood counts immediately after blood transfusion. You are just testing the blood you just gave, not the child's blood. It has not yet got enough time to mix. So I'm not able to comment on that. All right. But I'm happy you're in the hospital, so your doctor should be having this conversation with you, because they know more about your child than you can even tell me, because they have seen the child. All right. So Felicia is asking, good evening, thank you for your help. My baby of 7 months. Okay, sorry. I'm just checking Instagram to make sure I don't miss that. Baby of 7 months, I've been scratching her eyes, okay, when she wants to sleep. That is an habit. There's something wrong with that. But she starts scratching more on Friday when she's not trying to sleep, okay? Then I worry about that. And the corner of the eyes has small scratch. So number one, if a child is scratching, keep their nails short. You must cut their nails. And then the question is, why is the child scratching? What is irritating the child? Okay, so that's what you need to know. So you need to figure it out. Yeah, so and she has rashes around the nose and the lips. So again, that is telling me something is irritating your child's face, and that is what is making the child to scratch. That's what is causing the rashes. In my experience as a pediatrician, the most common thing that parents do to their baby that causes those kind of scenario is the oil they put on their head. They put so much oil on the head because I don't know whether the anterior fontanelle is a shrine that needs oil, but it is not. Okay, take it from me. You don't need to apply oil per second or per hour on the anterior fontanelle. You don't need to apply oil at all. If you put oil in the morning when bath the baby, comb the baby's hair, that is all for the day. That is enough for the day. You don't need to go and be putting oil every second. Like one of my parents said, that the anterior fontanelle is not a shrine, it's not a idol that you need to be putting oil on it every second. So, but what people that when people put oil, it will begin to drip down. It will drip down the face, and it irritates the baby's face. They tend to have rashes, and then they tend to itch. Some also apply powder. Babies don't need powder on the face. Powder tend to dry up the skin, and when it dry up the skin, it makes it also itchy. So I don't know which of this one you are doing. You need to stop, okay? And make sure whatever products you're also using on your child's skin, make sure they are not they are natural, or they don't have so much chemicals in them, okay? So the less chemical the better. So we call it hypoallergenic. So you want to use natural product, use your real shea butter, coconut oil, olive oil, Vaseline, Blue Seal. These are things that don't have much chemicals that you can use for your baby's face and all that. If you are using all these what's so-called sweet smelling, whatever, most of them, all those sweet smell is from chemicals, and they can cause allergies, irritation on the child's face. So you want to just make sure that you don't use them. Okay, I hope that is helpful. So if you figure out what it is that is irritating your child's face and you stop, it can even be something like some of us use wipes, all these wipes that we use on our children's face, and some of those wipes are, they have chemicals in them as well, and they can make the child to be itchy. So you need to figure out what it is that this child is reacting to. So it could be oil, it could be cream, it could be powder, it could be anything. So if you can't figure it out, then you have to see us, and we can help you to figure it out. And but sometimes just doing some of these things I've said, it will take care of your child's itches. So, but if not, or if the eyes is red and all that, then you can see a pediatrician or the eye doctors, you know. So, but usually sometimes then itching their eyes when they want to sleep, that is purely an habit. Is there something wrong with that? Okay, somebody is new on Instagram. Thank you for joining us, FT Adeoshun, I guess. Welcome. Thank you, Tara, for welcoming her on my behalf. So, but if you have questions, please ask. Okay, so Thomas Blessing saying, good evening. My baby of 8 months old is coughing and has catarrh. The catarrh is sometimes very thick and sticky, other times running. I give cough syrup. Don't give cough syrup to babies less than 1 year. You shouldn't, because saline is not good for babies. Then don't give it at all. But it has lingered for over 2 weeks, then you need to go and see a doctor. And I don't know what to do. Okay, so just late December, I treated him with antibiotic and cough syrup. Stop doing self-medication with antibiotics, and stop giving cough syrup to your baby. Yeah. So if your child is having cough catarrh that is going on, that is recurrent, because you say you treated in December and this is now February, and so the question is why. So like I said, we must develop that habit of asking why is this baby having cough and catarrh. That is the most important information that we need to deal with. Okay, number one, is this child going to a creche, daycare? Because some of these children, when they go to creche and daycare, they pick up germs from other children. Everybody's coughing, so as you are treating one and the one is getting better, and you are putting them back, they are catching from so they are just giving each other. So it's like a vicious cycle. So sometimes I've had instances I have to tell parents, just keep your child at home, and that is the end of all the cough and catarrh, because there's nobody else to give the child cough and catarrh when the child is at home. So sometimes you may have to consider option like, if it's a child who goes to daycare or creche and they're having cough and catarrh, sometimes it's just simple as just taking them out of the creche, get a nanny who can stay with them at home. Sometimes that may be the solution. You need to be sure that is not that. Number two is, are you exposing the child to other people, adults, or even siblings who are having cough and catarrh as well? Especially when children are in school, that could also be it. Sometimes even, are you breastfeeding your baby? That's one of the reasons we ask you to breastfeed, because you protect your baby against all this cough and catarrh through the antibodies that you pass to your baby in breast milk. What about smoking? Is somebody smoking in the house? Is there anybody, or are you putting your generator, all the fumes from your generator, very close to your bedroom? Are you taking the baby to the kitchen when you are frying your oil and frying palm oil, frying this? All those things irritate the airway. So you need to sit and think, are you spraying your room with insecticide? You have to sit and think about, what is it irritating my child's airway? is so if any of those scenarios I've mentioned applies to you, just dealing with them alone, you may just find out that that's the end. So also some children may have allergy condition where they tend to have recurrent cough and catarrh, like allergic rhinitis, their nose is always running, or they have allergic um skin rashes. Some also have even asthma. So you may, if that is the case, then you have to see either the pediatricians or the ENT doctors, because for those ones, your child has to be on medication for that. There's nothing that you're going to do that will make it go away, but you may avoid the triggers. So it's about figuring out which one. Why is my child having cough and catarrh all the time? And once you figure it out and you try to address it, sometimes it is as simple as that. But sometimes you still need to come and see the professionals, and we can take it up from there. So I hope that's helpful. All right. Sonia, okay, your child is going to 3 years. Okay, even though 3 years, I don't want you to give the child risperidone at all. And then the man, okay, so is it comes the psychiatrist managing your child? Unfortunately, the psychiatrist whom in Nigeria, most of them are not trained with the children; they train with adults. So then they now begin to apply the treatment to our children, which is actually why we have developmental pediatrician. We should not the babies should not be seeing CAMS. They should not be seeing the psychiatrists, because psychiatrists, no offense meant to them, but they tend to deal with medication more, and that is actually why we developed that developmental pediatrics separate, so that we deal with the children and we don't try to medicate every problem. Every problem is not throwing drugs. Drugs is not going to make the child talk. It's actually not going to, it's just maybe may just knock out the child and they just look dull and all that, but it doesn't solve the underlying problem of the autism itself. We usually reserve things like risperidone for children who are self-harming, when they begin to hurt themselves and hurt others, and they are a danger to themselves. That is when we now are forced to use medication. But a child who is just having normal tantrum from autism, we don't medicate them. We do behavior therapy. We do therapy, behavior therapy, speech therapy, all sorts of therapies, but not medication. Unfortunately, you see, that's the problem. The real thing that we should be doing for your child, which is behavior therapy, which is speech therapy, we are not even doing that. And because people don't want to feel like I'm doing nothing, and obviously we have medication, okay, let me throw medication at it, but it's wrong. And you need to go and read about those medication, read the side effects, go online, read about stamp and stomp. Yeah, you understand what I'm saying. The use of antipsychotic medication. Those are the same medication the doctors will use to treat people that have psychiatric mental illness, and they want to be using it for treating children who have neurodevelopmental disorders. It's wrong. We don't recommend it. We only use it in rare occasions. Definitely not in a 2-year-old. Definitely not in a 3-year-old at all. So that's not appropriate. Okay. Let's say, okay, so you use insecticide. If you use insecticide for your child in your room, you have to make sure you take the child away from that for at least, but the room has to be completely odorless by the time you bring the child back. Especially if you are worried about mosquito, let your baby sleep under nets, mosquito, long-lasting insecticide treated nets, and we don't really recommend spraying. But if you want to fumigate or spray, take the child away from the house. Make sure the house has been aerated, fresh air, the smell has gone before you bring the child back. So, and make sure you're breastfeeding your baby as well. It also protects your child against those infection. All right, so your child has to grow. Is it the same child or another child? Because you didn't tell us the age of this one. You need to tell us the age of the child. Always starts every question with the age of the child. All right. Okay, so let's assume it's a 9 months old. Is it 9 months old? How old was the child that you're talking about? Um 8 months old. Okay, 8 months old. All right. Okay, so you've seen the doctors. Yeah, you got the spelling correct. Yeah, Chalaxion. Yeah, it has gone completely and it's over. it has gone, it has not gone, because you said it has gone completely, and I'm like, if it has gone, why are you asking question? Or is that a typographical error? Because I'm not sure I understand. I say it has gone completely and it's been over a month. Is it has gone, it has not gone? I guess it has not gone. Okay, so if it has not gone, just go back to your doctors. Did you see the high doctors, or did you see the ordinary doctor, general doctors? So some blessing. I guess you meant it has not gone, but just so once you see a doctor, okay, I guess it hasn't gone. Okay, so once you see a doctor and the issue that they are treating has not gone, just come back to us. Just come back. Just go back to us and tell us this thing has not gone. Number one, there are many reasons for that. It does not mean the doctor doesn't know what they're doing, because some parents think that means the doctor is a fake. No, it doesn't mean that. So number one, it could be that the drug we're using is not working and we need to try something different, or maybe even try it at a higher dose or something. Sometimes maybe that the diagnosis is actually wrong. And what we think, because when we see something, we doctors, we are not always 100% accurate. Sometimes we think of this is most likely, and we start treating based on what we think is most likely. It may not be, and we need to consider our diagnosis again and all that. So, and we may need to say, okay, or sometimes treatment has some condition has more than 2 or 3 treatments. So we start with the common one. So that condition that you start with drug first. If the drug does not work, you have to do operation and all that. So I'm even happy you saw the high doctor, because I suspect as well that for the kind of terminology you used, only an eye doctor would have used it, which is perfect. So you go back to the eye doctors, they know what to do. Sometimes they may decide that maybe they need to actually open it up and bring it out, bring out the swelling, or so they know what to do. So just go back to them. Don't wait forever. Usually when we give medication, we always tell you how long we want you to use it for and when you should come back. I always do that. I always tell you when I want you to come back to see me. So if, of course, if your child gets better and you don't need me again, all well and good. But if there's no improvements, or you have completed the treatment, always come back to us for follow-up. So what you need to do, blessing, is to go back to the eye doctor for the follow-up of the eyes, so it will be fine. So I hope that's helpful. All right. My time is rushing. Oh my goodness, there's a question on Instagram. Finally, let me just quickly answer that before we round up. And I think there's one more question on Facebook as well. Osade Sonia. Okay. My 15-month-old weighs 10 kilos. That is okay. The weight is not bad. It doesn't eat enough and very picky. So I just did a teaching on fussy eaters, and I give you like tips of what to do for fussy eaters. I recommend that you watch that video again. If you don't know where to find it, just scroll through the same Instagram or go to our Facebook and ask this question. Somebody will give you the link to that video. Just watch it. It won't take milk from bottle. I don't want him to take from bottle. A 15-month-old should be taken from a cup and a spoon. And you just want to breastfeed, that's okay, but you need to give the child more than breast milk. All right. So I don't know what you did when your baby was 6 months old. That's when you're supposed to have started complementary feeding. Sometimes we also didn't do it properly at the right time, but not to worry. It's not lost. Interestingly, with all this not eating, also your baby's weight is still okay, which is good. So we still have some leverage to work on. So, but just go to our Facebook group, go to the guide section, do the guide on complementary feeding. Sometimes I find out that we as parents, we also don't understand what we should be doing. And so, for example, you shouldn't be giving your 15-month-old bottle at all. So that's actually not even an issue. So you should be giving the child things from the cup or from the spoon with a plate. And you should have started complementary feeding at 6 months. And complementary feeding is not milk, bottle, or formula feeding. It is giving the child real food, the same food you eat from 6 months. And of course, the texture will be different and all that. And then the frequency, the quantity, all those, there are lots of issues that we need to unpick. So I recommend for go to the guide section, watch the videos on complementary feeding for know what you should be doing. Then number 2, go to the webinar we did on fussy eaters, and you can also pick up some tips from that. All right. Ogechi is asking, how much water can a baby of 7 months old take? All right. So 7 months old baby, you should tell us the weight of the baby. The water a baby drinks, we calculate it based on the weight of the child. But let's assume an average 7 kg, 7 months old baby weighs 8 kilos. So all the liquid, not water, all the liquid that child should drink should not be more than 800 mils in one day, in 24 hours. So, and that includes breast milk, that include any pap, that include any formula, that includes plain water. So when you are you're 7 months old, we expect you to still be breastfeeding that baby a lot. So if you are breastfeeding that baby a lot, you don't need to give them lots of water. So, but you will now start giving them complementary feeding. So when you each time you finish feeding the baby, just give a little sip of water for them to drink. Maybe between 20 to 50 minutes of water, that's fine. And then you expect to give the baby maybe 2 or 3 complementary feeds in a day. So give them water after that, but keep breastfeeding. If you keep doing that, you'll be giving the baby enough water at all. So you don't need to rush them with water because they're already getting plenty of water from breast milk, because you're not supposed to reduce your breastfeeding. You keep breastfeeding and only start adding the complementary feeds. Okay. So just small sips of water after feeds is good enough, because you have to be mindful that you're also giving the baby breast milk and all that. And if you give too much of what's it called? If you give too much of water, the baby will not have space for food in their tummy. So okay, your baby is 7 kg. Okay, so your baby should be taking 700 mils of fluid in a day. That's a minimum, or that's the water requirement for the baby, and that includes your breast milk. So if you're breastfeeding well for a 7 months old baby, they don't really need to drink a lot of water. Just give them a small sip of water after feeds, after their complementary feeds, and make sure you keep breastfeeding them, and then you're going to get them enough water to drink. Okay, it's a straw cup. Actually, we started. Okay, straw cup is fine. Yeah, just check out our videos on complementary feeding and on fussy eaters. There are some babies are just fussy no matter what you do, but there you may be able to pick up a little strategy here and there that you can do. Okay, so but you don't also have to give your baby formula. If you are breastfeeding the baby, you don't have to give formula, but the child needs to drink water anyway. So that will be helpful. All right, our time is up. I need to go. But if you still have questions, and I know you may, or for those of who are watching on the recording, feel free to go to our Facebook group, Ask the Pediatricians, and you can post your questions there. My colleagues and I will try our best to answer your questions. Okay, Sonia said you are picky as well, so maybe it's hereditary, maybe it's genetic. Okay, so for us as pediatricians, we are not worried about your fussy eaters unless they start losing weight, or they have vitamin deficiency. So since your baby's weight is still okay, you still have some room to play around, but the earlier the better, because your baby is now over 1 year, and we expect you to, by now, your child should be on full family diet. So you need to work hard on it. With a lot of patience, with a lot of persistence, you will get there. Okay, so we have a lot of teachings on our websites, on our Facebook pages, our YouTube channel, our podcast, so go through all of them, you will learn. So on Thursday, one of my colleagues will be teaching us about cancers in children. And I know we just celebrated the World Cancer Day, I think on the 4th of February. And a lot of us don't think that children have cancers. Children do have cancers as well. I know it's so sad, but children do have cancers. It's one of the things that can kill children. Luckily, it's not one of the top, but it still happens. So we need to know how to recognize, just like any other thing else. The earlier we pick up the signs, the earlier we seek intervention, the better. Some of the childhood cancers, they can actually, if we treat them on time, the children can beat them and they'll be fine. So I know we've treated a lot of children with leukemia who are alive today, and they're fine. So children can beat the cancers. Of course, not everybody will beat it, but the most important thing is that the children cancer doctors, they want you to pick it up on time. And I worry about it in Nigeria because all our diagnosis is malaria and typhoid. Everybody is malaria type. Everything is not malaria typhoid. Some of our children having fevers ongoing every week is malaria. It's not malaria. You can't have malaria every week. Some of those children may be having leukemia, they may have cancers. So it is important that we pick up, for example, children who need blood transfusion. That's why I was worried about that question about blood transfusion, because I really want to be sure what are we dealing with there. So there are so many things we should be watching out for. So one of my colleagues will be teaching on this Thursday about signs of cancers in children and what we need to do as parents. So watch out for that. And but I'll be back next week Monday, and I'll be taking your questions. But if you have questions between now and next week Monday, feel free to go to Facebook, post your questions. My colleagues will be there to answer your questions. Till then, have a wonderful evening, and it is bye bye from me. Bye.